Hi guys, it's Adam here. I'm an orthopaedic surgeon. If you're about to have a total knee replacement, there are some things it's really important that you don't do before the operation to reduce your risk of an infection. When a knee replacement gets infected, this can be absolutely devastating and may even lead to further surgery to have all the implants taken out and new implants put back in. So anything you can do to reduce the risk of this happening is well worth it. In this video, I'm going to explain 3 simple things that you may do without even a second thought that can all increase your risk of an infection. If you find this helpful, please remember to hit subscribe for more videos coming up soon. As always, this video is for information purposes only, and you should please speak to your doctor before making any decisions about your care. Number 1. Avoid injections into your knee in the few months prior to surgery. This includes steroid injections and other types of injection that can cause suppression of the local immune system in the knee, so it increases the chance of an infection. In this study from the Hospital for Special Surgery, the authors looked at over 58,000 people having total knee replacement. A third of these had had injections into their knee in the year before surgery. And what they found was that if you'd had a steroid or hyaluronic acid injection within 3 months of surgery, the risk of post-operative infection was significantly higher. And there were lots of other studies which seem to show the same thing. In this meta-analysis published in Bone and Joint Research, it was estimated that the risk of infection when you have an injection in the 3 months prior to surgery is increased on average by 26%. So, the majority of studies seem to suggest that having an injection within 3 months of the time of your knee replacement is not safe. Having it more than 6 months before the knee replacement is safe, and between 3 and 6 months is probably okay. But if you're thinking of having an injection, it's definitely worth speaking to your surgeon to see what they advise. Number 2, even if you think it might be helpful, don't shave for a few days prior to surgery, definitely not around your knee, and it's safest to avoid shaving anywhere. When you shave, it causes small abrasions in your skin, which can act as an entry point for bacteria to colonize. Just before the operation, your surgeon will carefully trim away any hair in the operative field to make sure it's not in the way. In this review by the Cochrane Group, the authors looked at the evidence around this issue, and they found that when you compare shaving to no hair removal, for every 1,000 cases which are done, there will be around 17 more surgical site infections in the shaving group. Number 3. As well as avoiding shaving, you need to avoid anything else that may cause cuts or grazes in your skin, which can act as an entry point for infection. So when you're walking outside, make sure you wear trousers and not shorts to avoid insect bites and nettle stings. Wear gloves if you're gardening, and avoid getting sunburnt. If you do have an open wound or an infection that's not even related to the knee, such as a urinary tract infection, chest infection, or a dental abscess around the time of surgery, it's really important that you mention this to your surgeon. When you have an infection anywhere in the body, bacteria can enter the bloodstream. During a knee replacement, the tissues become inflamed and swollen and hyperemic, which means their blood supply increases. So as the bacteria are moving around in your bloodstream, it's a perfect place for them to settle, which can cause an infection. So your surgeon may actually want to postpone your surgery until the infection has cleared up elsewhere in your body.